Our next panelist is Gerald Wages. He initially retired in January of 2002 as Executive Vice President of North Mississippi Health Services, yet he continues to serve the organization as Vice President for External Affairs. Mr. Wages has served in many capacities under the North Mississippi Health Services umbrella, including Interim President, Chief Operating Officer, Executive Vice President of Finance, Vice President for Corporate Services, and CFO. Please welcome Mr. Gerald Wages.
But I'd like to talk just a little about health care and economic development. And I want to talk specifically about our organization, North Mississippi Health Services, and how we've affected economic development in North Mississippi, because I think we have. I think we've had an impact. I've heard a lot of great speakers this morning talking about how health care is going to change, how it has to change, and I agree with that. And if you could fast forward 10 years and look at the health care in place, you wouldn't recognize it. It's going to be different, and it has to be different, and it needs to be different. But I'm not going to talk a lot about health care. I want to talk about health care and economic development. Let me tell you a little about our organization, and I think you may know I'm with North Mississippi Health Services. I'm with North Mississippi Health Services in Tupelo, and North Mississippi Health Services is the parent corporation of a number of things. We operate 8 hospitals. But our flagship hospital is North Mississippi Medical Center in Tupelo, and this is kind of a shot of our Tupelo campus. And the medical center includes actually 3 hospitals in Tupelo. This is our flagship medical and surgical hospital. We also have a women's hospital and a behavioral health hospital in Tupelo. But the medical center is 650 beds, is one of the largest hospitals in the state. In fact, there are a lot of ways to measure size in hospitals, and I think in bed size it may be the largest in the state. But among other sizes, we're among the largest hospitals in the state. And we're in a town of 35,000 people. So how do you develop an organization like that? How do you develop a hospital like that in a town of 35,000 people? We literally are the largest hospital in the country outside a metropolitan area, the largest rural hospital in the country. How does that happen? Well, it happens because of community spirit and community involvement, and because of just sheer determination of getting it done. The medical center, you may know, was actually built by the Commonwealth Fund in New York City back in 1936 and 1937, and it started with a vision. And the Commonwealth Fund back in the early 30s had a vision for a new kind of health care. Think about that. A lot of us have that vision today, but a new kind of health care, and they wanted to experiment with a health care system that would be hospitals that would be not-for-profit hospitals, but would be governed by businessmen and businesswomen on business principles, because they didn't see a lot of that at that time. And they wanted to establish the business principles of health care and build hospitals built on those principles. So they offered opportunities to apply for a grant to build a hospital. They would actually come and build, and Tupelo applied. And in 1935, Tupelo was informed that they had been selected for the site of a Commonwealth Fund hospital with some conditions. The first condition was it would be a $300,000 75-bed hospital. The Commonwealth Fund would provide $260,000, but the community had to provide $40,000, with the condition there could be no government money involved. It had to all be private money. It had to be private-raised money. So in 1935, the citizens in Tupelo set out to raise $40,000, and they found that you could raid every bank vault in town in 1935 and not find $40,000. It wasn't there. We just finished the Depression. So we set out to raise that money. And literally people left their jobs to go out and raise money. And by April of 1936, had raised $32,496 and had just given up. There wasn't any more money to be had, short of that $40,000. And you may know what happened. In April of 1936, then the Tupelo tornado came along and just wiped out the town. It's still the 4th deadliest tornado in our country's history. It killed 200 people in Tupelo. And the Commonwealth Fund folks came along and saw the damage, and they said, look, forget the rest of the money. We'll take you $32,000 and we'll build that hospital. And so they built what was then North Mississippi Community Hospital, became North Mississippi Medical Center, and that's kind of a shot of the original hospital. And the nurses' dormitory. Nurses lived in the dormitory because they weren't paid enough to afford to live anywhere else, so the original nurses' dormitory. But that's where we started in 1936, and that's kind of what we've grown to today on our Tupelo campus. And a 650-bed hospital, and serving a lot of northeast Mississippi. We actually own and operate 6 hospitals, and you can see the locations there. And we manage 2 hospitals that we don't own, but a total of 8 hospitals, but 6 that we own and operate. In addition, the organization includes 40 physician clinics, because it's important to get out and reach the population. You can't reach all the population sitting in a hospital. You have to get out and provide access points. So we have 40 physician clinics, in the 14 counties that provide access points to the system. Many of those are walk-in clinics, open, some of them 24 hours a day, but walk-in clinics where you don't have to have an appointment. You can't always make an appointment. If you feel bad, you can go and walk in the clinic. So a number of walk-in clinics, but 40 clinics in 14 counties. Well, that's well and good, but what does that have to do with economic development? The first impact that we have is the payroll in our community. The financial impact of the payroll in our community has an impact on economic development in our community, and I'm told that we are the second largest private employer in Mississippi. Now, there are larger employers, there are government employers, there are colleges, there are universities, there are government employees, a lot more people. But I've seen lists that put us as the second largest private employer in Mississippi behind Ingalls Shipbuilding, Ingalls being the largest. That's an impact. Our annual payroll, we employ a total of 6,229 people located in 15 counties, and those are the counties in which they work. But 6,229 people. Our annual payroll is $320 million a year, and I've been told that the payroll turns over about 5 times in the community. I don't know if that's true, but all of us as employees take money and spend it at the grocery store, and they take money and spend it at the gas station, they take money and spend it somewhere else. It turns over about 5 times in the community. If that's true, then our $320 million payroll would have a total impact of about $1.6 billion a year on the Northeast Mississippi area. And that's a significant impact, and that's a significant impact toward economic development. So just the existence of our organization, and not my organization only, but all the hospital organizations, have that impact on their communities. The second thing I think, the second way in which I think we affect economic development is by maintaining the health of the population. That's important. I would guess that probably everybody in this room has been involved in industrial recruitment at one point in time, and you know that if you're going to recruit an industry, you have to be able to show them that you have an employable population. You have to have a population that's healthy enough to get to work in the morning and stay at work and be there, and the health of the population is important. We've worked hard on maintaining the health of the population, and in 2012, you may know Tupelo was named as the healthiest city in Mississippi by the Blue Cross Foundation, and we worked a lot to get that done, and that's important. The healthiest city in Mississippi. We've won a number of quality awards, and quality is really important in healthcare, and in economic development, quality is ultra important. The American Hospital Association presents an award once each year called the Quest for Quality Award to the one hospital in the country with the best demonstrated quality management programs, and we were fortunate enough to win the AHA Quest for Quality Award in 2005, and we're pleased to get it. The Malcolm Baldrige Organization, you may know, presents a quality award each year, or quality awards each year, and the Malcolm Baldrige Award is presented by the U.S. government, the Department of Commerce, but it's an award not given just to hospitals, but given to industries or employers, any organization in the country that can demonstrate really good, effective quality management programs. North Mississippi Medical Center won the Baldrige Award in 2006, and we were the only hospital in Mississippi to have won the award, one of the few nationwide. But in 2006, we won the Malcolm Baldrige National Quality Award, and that was the medical center. We decided to apply for the award again for our system as a whole, North Mississippi Health Services as a whole, and North Mississippi Health Services as a whole then won the Malcolm Baldrige Award in 2012, and we were pleased to get that award. And getting the award is not important. What's important is the process that you go through to establish those quality programs, to be sure that you're providing good quality services, to be sure that you have good quality planning. The outcome from that has to be good quality health care. The outcome from that has to be a healthy population, which will lead to good economic development and will enable good economic development. And then the third element that I think is important when you look at hospitals and economic development is the fact that hospitals and health care provide the infrastructure to support economic development. Now, all of you have probably been involved in industrial development, and I can tell you in Tupelo, when we're recruiting an industry in Tupelo, we always get a chance to meet them when they come to town. But when we're recruiting an industry in Tupelo, what usually happens is once the potential sites is narrowed down to about 3 or 4 sites, the potential industry will send an advance team to town. And during that first visit, they'll spend the morning at the school system, and they'll spend the afternoon at the hospital. And I've spent many afternoons with prospective employers, prospective industries in the Tupelo area. I'll always remember the day I spent with the folks from Toyota, and we had the national medical director from Toyota at our hospital and spent the day with us. And guess what he wanted to talk about? Quality. I mean, he knew about health care, but if you want to talk about quality, Toyota can talk to you about quality. That's what he wanted to talk about, and we were able to spend the day just talking to him about our quality, about how we manage the quality, and it was an effective day. On the other hand, if the advanced team comes and they're not pleased with what they see at the education system, if they're not pleased with what they see in the healthcare system, then they're going to leave there not feeling good about bringing their families to our area, about bringing their employees from around the country to our area, and they'll go somewhere else. If we can convince them during that first day's visit that we've got the education system in place, we've got the healthcare system in place, we've got the infrastructure in place, then we have a chance to recruit them. And as we set out to recruit more industries and more employers to our area, I think healthcare has to be in the forefront. It can't be in the background. We have to talk about it. We have to be working hand in hand together, and we have to be doing those things that will get those employers here, that will get those industries here. I will tell you that the healthcare industry in our state is going to continue to grow. We're so fortunate in our state to have so many great hospitals, so many great healthcare organizations around our state, and we're privileged just to be one of those, one of many. It's been my privilege in my career to work with so many great leaders in healthcare around the state and to be a very small part of the leadership in our state. But I've always been impressed with the great leadership that we have throughout the state in healthcare and the impact that they've had and the effectiveness they've had in maintaining our healthcare in ways that's just second to none. So it's been good to be a part of that. So I think I would remind you that healthcare has a big impact on economic development. Healthcare itself is important because of the economic impact of healthcare itself, but it's also important because of the impact that we have on the ability to recruit other industries to the state who will be here and be a part of making the state something better. Thank you very much.
So you can see that Mississippi does have success stories. We've talked from the folks from the South, we've talked from the folks from the North, and we do have a lot of things to be proud of. And so I'm hopeful that we have some stimulating ideas and discussions as we go forward so we can have new ideas so we can take our state farther down the road.